When working at a hospital, a good thing to be familiar with are hospital codes. I will go over what they are, what they mean, and how you should respond as an occupational therapist. Hi, my name is Jeff, and I'm an occupational therapist who makes free content not only on YouTube, but on my website and podcast. Be sure to check out the links in the description. Let's get functional. The codes I will go over are for the hospital system in the United States. Your facility may be different, so be sure to go off of your hospital code system where you specifically are going to be a student or work at. One thing you should know is that you do not, of course, need to memorize hospital codes. Yay! On the back of your worker ID badge, you may get a cheat card of the hospital codes. In general, paying attention to the code themselves is something you should do. These are often announced over the intercom or PA for everyone in the hospital or facility to hear. Yes, including the patients. So you should definitely have some alternating attention and not only focus on your patient during your occupational therapy sessions, but also to pay attention to your surroundings. When I hear someone talk on the PA, sometimes I even kindly ask my patient to pause and stop talking so that I can listen to it because it may pertain to my safety as well as the safety of my patient. The source of this information is from the Hospital Association of Southern California's Uniform Code System that was implemented in the 2000s. First of all, if you're unfamiliar with how to activate or call a code, it is important to learn how to do that. You likely will have a staff-issued phone on you at all times, or you can use the hospital's phone system as well. You should definitely learn what the number is to dial it, and every hospital where you work may have a different prefix. For a code to occur, it is often necessary to report where your location is, so be aware of where you are at all times, such as what unit you're on or what that is specifically called so that the necessary staff can respond appropriately. Okay, so let's start. Code Amber or Code Pink is an infant or child abduction. This can occur anywhere in the hospital, but people often think of the maternity unit or the birthing unit where there are newborns. They most likely won't announce who it is. It could even be a family member themselves, but someone has abducted a child from the parents or from the unit itself, such as the NICU, without permission. What you should do is act quickly and secure the exits. Close the doors to slow down the suspect from escaping from the facility. Staff, including you, even if you're charting, I would say not working with the patient and it's safe to step away, you should then secure the exits and start looking for someone suspicious. Basically someone who's carrying a child either like on their arms, or they look like they may be hiding someone in them, or if they're hiding them inside of something like a bag, a baby carrier, a child seat even, may be a good kind of thing that they may use to hide a child or pretend like they're going out normally. So what I would do is err on the side of question and stop them and question them, or at least hold them until the staff can respond and you can kind of eliminate this person and clear them to leave the facility. This is why it's important to know where you are so you can report it right away, such as to security personnel. In most hospital systems, especially in the maternal child unit, they likely have an alarm system in which when the newborn leaves without permission and they have basically something attached to them like a device, kind of like a shoplifting device that you see at shopping malls, it'll basically go off at that door and it'll alert basically like lights and sound, and it's really obvious. And hopefully, fingers crossed, this code gets cleared with the code clear or code 100 or whatever the code clearance lingo is where you work, and the infant is returned to the proper parents and the unit. And this code is very stressful for staff, especially for all of us who are parents or have young children of our own. Worst nightmare is child kidnapping. So I'd say when you hear this code, it's a really intense one. Code Blue is for cardiac arrest. This alerts a necessary team such as rapid response team to act and begin resuscitation if the patient is basically not a complete DNR, do not resuscitate. Ideally, when this code blue is called, things happen at the same time. Basically, the necessary staff will mobilize, equipment such as crash carts are gathered and brought to the appropriate location, defibrillators are brought, and people who are ready and trained to do compressions are there. So for you, the OT, is good to know this code because you are trained to do CPR, such as compressions. If you notice someone going down or they've lost their cardiac pulse, they're unconscious, and you suspect they may have a cardiac issue, then you would need to call this code yourself, especially if you're the first one to notice. And of course, as necessary to provide compressions as you're trained in your BLS program. Similar to Code Blue are Code Pinks and Code Whites, depending on where you work, which is a pediatric and neonatal emergency, respectively. This lets units such as the NICU know what is going on for them to respond specifically compared to a Code Blue. Sometimes even EMS or when a helicopter is arriving to the helipad, They may have this code to alert the staff so that they know to prepare and to be ready, such as bring the neonatal crash cart or having the appropriate specialists ready. It's more for the emergency room, but it can also apply if it occurs anywhere in the hospital. Code Brown is for severe weather. Depending on where you work, this may be called more often than not. I actually have never heard this one be called where I work, but in some places this may be quite common. And your facility may have specific protocols on how to respond to, say, a snowstorm, or hurricane, or earthquake, and so on. Another fun thing you should know is that Code Brown may be used for a patient's uncontrolled release of feces that requires cleanup by staff, basically fecal incontinence. This is really meant for more the immediate staff on the unit or like personnel than it is to be announced hospital-wide, of course. It's not that big of a deal. It does require attention. Code Gray, that is for a combative, or in my experience, even a very agitated person who may escalate into being a combative person. It could be anybody who may be a danger to themselves or to others, such as family and staff. If they have a weapon, then a code Silver would be called, such as for someone who is an active shooter. Hopefully you never hear this one. Code Gray and Code Silver immediately alerts security personnel to respond appropriately, and especially this includes the location of where they should respond. And other staff may intervene as well, such as the nurse or the staff responsible for this patient, such as on a psych unit. It's important to know that a Code Gray can occur anywhere too. It's not just a specific hospital room or a hallway. It can occur on the elevator, in a stairway, even on the parking lot outside, so on. How you should handle these situations, such as persons with weapons, or how they're acting and behaving, depends on really where you work. I wouldn't say there's one size fits all. For example, you may be expected to de-escalate, or to run, or to hide, or to eventually fight back. So it really depends. Some strategies overall in general are to not look threatening, leave plenty of personal space, not to raise your voice when you talk to them, to even ask them to calm down, as this may further aggravate them. Ask your management team for literature on how to handle these situations or how to obtain training on this, as it's something that's very useful in general. Another thing to be familiar with is how to use and handle restraints on patients, including how to tie the knot, where to tie the knot, and where to find the restraint supplies themselves, and how to document as necessary. This is often used as a last resort, and it may require an order depending on where you work. Generally used as a last resort for safety. Code Orange, depending on where you work, is often used for a hazardous spill. Say a chemical is released or spilled somewhere on the ground or on some equipment, or even worse, like a patient or you. Along with this code, you should know where the chemical safety documentation, such as the book, is for the hazmat emergency response book. And there should be one on every unit or every location within good reach. And it instructs you basically on how to handle each specific chemical safely. Each chemical varies on how dangerous it is and how it should be handled appropriately. If you're not comfortable with what to do, ask for help. Never try to clean up a spill yourself if you don't know how, or what you're doing, or what supplies to use. You should probably not be doing things like use the elevator, and that goes without saying, or come in contact with the chemical or material as much as possible. Some more severe substances may require special teams, such as hazmat, to handle, so it goes on a case-by-case basis. If you have been exposed to a chemical, alert the management and seek medical attention immediately, such as with your caregiver health team. And so along with this, another thing to be familiar with is where the eye wash stations are, where the emergency chemical wash showers are, where the sinks are to wash up in general if something like this were to happen. And this is a personal thing, but it's probably a good idea as an occupational therapist to keep an extra pair of scrubs or uniforms in your locker in case you need to change. Code Red means fire. So you should learn where fire exits are and where fire extinguishers are, and even how to use them, I would say. Avoid taking the elevators and tell people to avoid taking the elevators. Take note of where stair chairs are for evacuation, and you should be familiar with how these work as well and how to evacuate people down the stairs with this type of equipment. That might be a little bit too much, but personally, I feel more comfortable being more competent in a situation where I may be able to be a resource to help people. Maybe that's because I've had training as an EMT, but I think it's just a cool thing to know just in general. Some protocols ask that fires be contained, such as closing doorways or even patients' doors to contain the fire until that code red is cleared. Sometimes that may not be the case depending on where you work. And most of the time I find that it is often a fire drill, but you should definitely treat it as the real fire. You should learn the mnemonics for this code, which are PASS, P-A-S-S, and RACE, R-A-C-E. P stands for pull the pin of the fire extinguisher. A stands for aim at the base of the fire. S for squeezing the handle of the fire extinguisher. Last S is to use a sweeping side-to-side motion. For RACE, R is for rescue, A is for alarm, C is for containing the fire, and E is to extinguish and if need be, to evacuate. And this is a fun one because it's a favorite for auditors and joint committee to ask when they're on site for doing an audit. Code Black is a bomb threat. According to this one procedure I found online, the steps are to basically keep calm, and if someone is calling about a bomb and you're the one responding and on the other side of the line, to obtain a bomb threat checklist and follow the instructions. Note the time of the call, words of the caller, the voice tone, gender, age, background noise, and then notify the necessary response team, such as calling the police. If you notice a suspicious package, do not touch it, of course, or allow anyone else to remove it. Call the code and 911 if necessary. And if the bomb threat is serious enough, there may be an evacuation of the entire hospital. Hopefully not, fingers crossed. Wait for the code clear to return to the facility when safe. Code Green is often used for emergency activation. In other facilities, this color may differ, and a lot of these codes I use depends on your facility. Like I said earlier, the color may change, but the meaning is basically the same in how you respond to it. For example, instead of code green, it may be code black, which is used for a bomb threat. And where I actually work in California, I think, based on the state, code green is used for patient elopement, or for those who are a flight risk. Basically, a patient who is either missing or trying to escape the hospital and is unsafe to do so, in such as being confused or altered mentally, and they're getting on the street would be doing them serious harm. The best thing is to prevent this from happening in the first place. Educating patient, staff, posting elopement or flight risk signage, keeping doors closed where they should be, using alarm systems, and so on. However, things happen, and a code green, when activated, is used for elopement, and it's similar to a code amber. You can think of it like a child abduction and how you should respond. Hospital personnel will basically keep an eye on the exits and basically anywhere where that location is reported and locate that person, return them back to the unit safely. So keep your eyes out on your patient, but also for these kinds of things. And of course, don't let this happen to you. Don't let your patient escape and have to call a code green or have a code green called on you, because that can be very embarrassing. The last code I will cover is code triage. As it contains the word triage, there is probably like a major event, such as a plane crash or a crisis, big bombing, something major that will make the hospital basically expect, and also other hospitals nearby expects, an influx of patients due to this event. And patients will need to be triaged, possibly admitted to the hospital system. Code triage may have 2 or more levels as well, going up in seriousness and severity, such as code triage 1, which means to prepare, such as an incident being reported on the news and it happened, and code triage 2, meaning EMS or things are basically happening, are coming, and to prepare even more. If you work in the ER, such as an occupational therapist in the ER, this would definitely concern you more. Now, it's not that you will likely be triaging yourself. That'll be already done in terms of the code colors, and a nurse will probably do that in the triage, but you will probably be responding as an occupational therapist and helping appropriately. One thing you should be familiar with are the triage colors that EMS uses. Basically, when EMS responds to a situation like this, they will quickly tag and literally place tags, at least that was the traditional method, or somehow indicate with colors that the patient is a certain amount of severity or not. The triage colors generally are green, yellow, and red, kind of like the stoplight, and then black. Green is for walking wounded, or basically someone with a mild condition. They can walk around, they're doing pretty well, but they're not normal either. Yellow are for those who are moderately injured but are stable. And then you have red for those who are in critical condition and they need immediate medical attention. Black, you probably wouldn't see or work with, as this is for those who are deceased and did not make it. If you're interested in the world of triage, some emergency preparedness organizations, such as EMS programs, I don't know if it's open to the public, but you could definitely probably volunteer as a role player and practice with tagging people, or at least be a victim. And it's kind of fun and very eye-opening experience. I practiced this in EMT school and it was very insightful and pretty interesting. So this is not meant to be a complete list of the hospital codes, but covers most of the most common and important ones. If you found this video helpful, give me a thumbs up and don't forget to check out the links in my description for more helpful resources. I'm Jeff, the OT Dude. Thanks for watching and have a nice day.